Good afternoon, everybody. With blessings of Prafull sir and Hahnemann sir, I'm going to present a case today. I'm very nervous because I was not prepared at all. So yes, like Dr. Shrikant, even I was underprepared. I discussed this case with Ambrish sir. Yeah, you did. Ambrish sir said, "Kai nahi, karun tak, we'll see." So I had just made a PowerPoint presentation long time back. So this is a case of Mrs. Katie. She's 30-year-old female. So this is the date of consultation, November 2016. I had started my practice in March 2016. So this was the first case which gave me little jitters because it was a very initial phase where you do not have any confidence. You're just out of the oven, straight from Sir's clinic to starting your own practice. So that underconfident and insecurity was always there. So this case taught me a lot in itself. So it was a case of fibromyalgia diagnosed in March 2016. She had come to me with right-sided weakness and pain in the occipital region since 2000. The right shoulder pain was so much that she could not carry her bag or anything in her hand. And this was aggravating since, it had started in 2000, but it was aggravated since March 2012. History of weight loss of 8 to 10 kgs in a span of 6 to 8 months since Jan 16 again. Currently, she was weighing only 35.9. She was a 30-year-old female. She also complained of a right side lump in the iliac region since 2 months. And the right side of the neck was very painful, and there was a nodule in the nape of the neck. And so basically the complaint was very stiff from here, from the right side. So she could not move, she could not bend or take anything. Next slide, please. So the journey of disease was in 2002, she had an epileptic attack. So epileptic is what she told me, but there were no MRI scans. But she had a complaint of right hand coldness with stupor and delirium. Tongue bite, jaw clench with numbness and formication in the right hand. So since 2002, she used to get such episodes for at least 4 times in a day for the next 3 to 4 months. After 6 months, she started the pain in occipital region again. This is the history. So pain in occipital region has started then, recurrent throat infection, recurrent right submandibular inflammation and cervical lymph node swelling. So it had little small swelling, inflammation had started coming up in different systems. 2011, cystitis. 2012, severe major attack of cervical spondylosis and few lymph node swellings on the right side. And the pain was extending to the shoulder with stiffness and restricted movements of the neck to the right side. This was treated with physiotherapy in 2012. 2016, the similar complaint had started. And because since Jan she was losing weight again, in March, so she saw me in November. So this was the history entirely. 2016 there was metrorrhagia. 2016 again March, again severe attack of stiffness and pain in the right. So these complaints were coming back, every 3 to 4 months. She used to take some medicines, physiotherapy, getting suppressed, again coming back. So and in September 2016, herpes on the right hypochondriac region. And in November she came to me. So what is fibromyalgia? Fibromyalgia is basically a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way of your brain and spinal cord process painful and non-painful signals. So basically it is a connective tissue, musculoskeletal level, there's connective tissue disorder. Symptoms often begin after an event such as physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering effect. So this was basically started in 2000 and 2016, this was the entire history, the small inflammation. So basically her mentals were, she was very conscientious, diligent, never got love and attention from mother since she was a very successful working lady. Her mother was very busy. So that typical that she wanted her mother's love, but she never got it because her mother was very busy. Sensitive to criticism and insults, and the reaction was anger and hurt. Very critical and fastidious, consolation, aggravation, very strong-willed person, need was love. And she said, I always feel that I should keep So basically, she had a very childhood where her mother was not there for her. So when she grew up, she had this thing that I will always keep my professional life and my personal life separate and not mix it up. So I will give my daughter a better childhood. That was her main thing since always. My parents were never supportive, and even my in-laws are very cunning, torturing and insensitive. She had got married, and in 2012 she got married. And same history during after marriage also, that in-laws were also not supportive. So, okay, you can go back. I'll say this later. So when she came to me, so this is the only history she gave me. I tried to ask her the cause, that 2000 what had happened, where you felt helpless, or right side, so like sir said, and back then 2016, so right side was work related, father related. So that time delusions, and we did not go back in that delusion that much. So it's like right sided is everything, work and everything. So I asked her, where your work, where you felt helpless about your career, where you thought that you couldn't do much. So she did not give me anything, not a single bit of history. Nothing doctor, nothing doctor. So I started asking about her married life. So her husband is supportive, yeah, husband is supportive. And daughter, how old is your daughter? My daughter is 8 years old, 4 years old. So what is her birth year? 2008. I said 2008 and we are in 16. So 4 years would be 2012, right? Oh, sorry, wait. She was counting on her fingers. So I thought maybe she's nervous, so she mixed it up. Again, after a while, I asked her about her college or something, that when did this started? What were you doing? So I was in a 12th standard. It was in 2001. So 12th and 2001, you did just now? No, sorry. Again, she started counting on the back of her fingers. So she was every time miscalculating and confusing me also. I was already confused, but she was confusing me more. Because I could not know that मैं ODP अभी ऐसा लूँ या मैं वापस पीछे 2011 पे जाऊँ. I was not understanding, just mixing up all my ODP everything. Then again one more point she came, that she said that whenever doctor I'm ill, and back then she used to take homeopathic medicine because वो चाचा काका मामा someone practices homeopathy, have a box, so ज़्यादा ये हो गया bryonia ले लो pulsar, that type of practice. So someone, a doctor had told her that you take one certain medicine. So she said, whenever I used to go to take a medicine, I have decided I'm going to take bryonia, but I used to take platina. Once that happened. Again, acute illness, I went to take CPR, but I took Epicac. I said, how is that possible? I don't know, doctor, that always happens with me. So I had so basically I was not going anywhere in the history. I was not understanding what to do next. Then I remember Prafull sir. When the patient is not giving you a cause, you have to hunt. You have to look, you have to find it, because sir is to say, remedy बोलेगा, remedy बात करेगा अंदर से, remedy will tell you कि क्या है, the rubric, the patient will start telling you, even if he's not telling you verbally. So then I looked up one rubric, which is, थोड़ा पुढे जा ना, पुढे जा. हाँ. So confusion, concentrate the mind attempting to. So this was the rubric, and I took one more rubric, confusion calculate. I'll tell you why I took these other rubrics later. Confusion calculating when. So my entry point was that, confusion calculating when. There are only 4 remedies in this. I'll come back to that later. So confusion, because every time I asked her daughter's age, she used to mix up the year of birth, or she used to tell me 8 years, when the daughter was only 4 years old. So you don't know how old is her daughter. You think ये बराइटा है, ये बराइटा लग रही है, उसको नहीं पता है. So it was not baraita, it was not incapacity. She was getting confused while calculating. Same thing was here, confusion to concentrate the mind. Whenever she used to concentrate, कि अभी मुझे ना, I'm feeling ill, I want to take an Epicac, I used to take platina. But I don't know why I took that. So I had looked up these 2 rubrics, and the remedy which was coming up was natrum. But she was a chilly consensus remedy, so I had given natrum carb 200. Now the magic happened after natrum carb 200. After 2 weeks, when she came back to me, she came back with a 4-page letter. And she had mentioned every detail of her life on that paper. This is the height of secrecy of a natrum. So half of the homeopaths think that हम metal catharsis करते हैं और placebo की भी ठीक हो जाएगा. लेकिन mental catharsis ऐसे ही नहीं होता है ना. It came after, in this case, it came after natrum carb. Mental catharsis She wrote a long letter where she has mentioned, I cannot because that is a private letter. She has mentioned the words like, I felt like a living being for the since 12 years, I was feeling like a log. For the first time, I felt like a living being. After doctor taking your medicine at 3 p.m. I took, next morning, I woke up like a living being. I was walking like a log. I can go back. Yeah. So yeah, there was one more rubric. Sorry, I missed that. Oh, piche jayenge. So she did not come only with physical complaints. She had very two classical delusions back then. She felt that there is a stick. Yeah, she felt that there is a stick in the back of her head, going from her spine till her, till the end of the whole spine. A stick, which is not letting her move left or right, which is making her stiff. And the other sensation was, whenever I'm talking, doctor, I feel there is a line, linear line again, passing on the middle of my body. One side is yellow, one side is white. Now what to make out of this? So then later, because she had given me delusion, but she never came up with the cause. So that is why I did not say this, because after the 2 weeks when she wrote the letter, I could make out the cause. So her cause was that because her mother was so strict and never gave her love, she was also career oriented. She wanted to become a doctor, but she could not do. Like later she did and whatever. But so when she became a businesswoman of her own, made out of her own self, she did not wanted to mix her career with her daughter, and she could not find that time. And that delusion made that stick, that feeling of I cannot go left, I cannot go right. From there, that stiffness had come, that I cannot bend left or I cannot bend right. And after Natron Cup 200, even that stick went in 2 weeks' time. So this is a chronic case, but it gave result like an acute. 2 weeks' time, this lady came that stick has disappeared. That line which was dividing me, that also disappeared. So introspectively, again, we are homeopaths, we self-doubt ourselves back then, just starting practice. I said, Natron Cup to theek hai. So I'll just give you a quick history. In 2000, when she was 16 years old, there was an incident of molestation by her grandfather, who was mentally challenged. I was shocked and did not understand much that time. And when I told my mother, she just brushed it off. Even I forgot about it in 2 months. This history she had never told anyone in her lifetime. Never. So this is what I was saying, that this all she told me in the history. In childhood, she used to masturbate and felt very guilty about it later, so much that she still does not look at herself in the mirror. Feels ashamed, which is why God is punishing me. Started feeling that I am smelling very bad, like a green odor, like a green color. Met with an accident, after which she was on bed for 4 months in stuporous condition. And in stupor, she used to mutter, "Please don't kill me, I have not done anything." So this was in 2000. After this, all these complaints had started. Used to feel like dead body even while walking on the road. Used to feel I'm smelling like a dead body, horrible, offensive, putrid. In 2002, after 12 standard, she wanted to pursue medicine. But due to lack of funds, mother refused, so felt shocked as all the teachers had hopes from her that she will do medicine after 12, since she was a very bright child. Feels like my right, now this is that thing about, the line dividing me. Feel like my right brain and my left brain do not communicate with each other. Sensation of a linear stick passing from head to the back and differentiates my left and the right side. So this was the differentiation she wanted to make between her professional career and her private life. I can see a yellow line in the middle which also separates my left and right side. So basically everywhere there was complaints which were not letting her divide, mix everything. She wanted a clear division between my professional and this. Next slide, please. Something very peculiar, I told you that regarding the time span, she used to get confused. How old were you then? She used to get confused, so confused while counting years back. How old is her daughter in 2016 if she is born in 2012? Such questions also she used to get very confused while answering. Whenever she is unwell, she ends up taking wrong medicine from the medicine box. Even if she concentrates, she ends up taking some wrong tablet and says, I always get confused. So later, back then I had just taken confusion calculating when and I had confusion concentrate. But later I said that let's, reverse the case and see. So that is the time I took this rubric because she felt disgraced. Delusion, disgrace she is. She used to feel bad about herself, which is why that I am a dead body, I am smelling foul. People, because she felt disgraced because she used to masturbate and she could not forgive herself till the day she was in 2016 also. The childhood that I am masturbating, I'm a bad person. And she never said this to anyone. So she only had degraded herself. And this delusion, division between himself and others. So I don't want to become like my mother, which is by the division. All these rubrics cover natrum. So yeah. So it was natrum, natrum sal, nux and mag. So Macab, she was not like a magnet. She was very angry, very revolting. She was not. She never felt orphaned in spite of the mother not being around. So we would have thought that, अरे magnesium orphan feel. वो orphan नहीं था. She just felt that she should have given me professional. She shouldn't have concentrated on her profession more. So natrum carb was giving 200. And after that, in these 200 only resolved all her complaints. Within 1 month, her right-sided weakness, her lymph node swelling, everything had gone down. And she was absolutely normal. And yeah, so that's about it. She became a human. Yeah, she has written. So she also had a feeling for so many years that there is a heavy burden on my chest. And after taking natrum carb, doctor, it just got disappeared. It lodged off. One on the chest and one on the back of the head. Now this was right side of, so probably about the sexual abuse from her grandfather, which was always lodged in her mind, like she said. So this is mine, na? We say कि हम सोचते हैं दिमाग से. So that was that thing, and she had never told that to anyone. And as soon as she had jotted down everything, all these things disappeared. So that's it. Thank you, Dr. Ambrish, for this opportunity. Thank you.